Good morning, guys. This is Dr. Ray from the Spine Health Center. Today I'll be talking to you about Carpal Tunnel Syndrome, as well as giving you some exercises and treatment how to work with this common condition. Carpal Tunnel Syndrome is one of the most common causes of wrist pain and numbness when it comes to typing, when it comes to any type of work and computer work in the population in general, right? Typically, carpal tunnel symptoms start all the way from your wrist. It can go into your first and second digits, as well as traveling up to your elbows. Typically, people come in with numbness, burning pain, symptoms that really cause a lot of irritation here. I'm going to proceed now to talk a little bit more about what exercise you could do at home that can help with those symptoms, as well as give you some heads up of what we could do in the office to help with this particular condition. So guys, I'm going to show you basic exercises you could do at home to relieve most of your symptoms, as well as just working it out. That way you could just probably type in the computer, go to work with less pain, less discomfort, okay? First thing, like I said before, I highly recommend a wrist brace to wear it at night. They sell this wrist braces that has like a hard surface right here. That way prevents you going to a lot of wrist flexion, especially at night. You're gonna sleep with that. That usually helps with the symptoms. Second of all, wrist extension exercises. Wrist extension exercises, you're gonna do this anywhere at 5 reps, anywhere from 4 to 5 times a day. So you're gonna grab your fingertips, you pull it all the way up into your forearm, hold it for about 5 seconds, and then relax. I'm gonna go in side view, that way you can see it as well. Pull your fingers all the way back, hold it for about 5 seconds, and relax, okay? Then we also have the wrist flexion exercise. Kind of the same protocol. In this case, you go with the fingers down, wrist flexion, hold it 5 seconds, and relax. If this is too provocative, you guys should stop, okay? None of them should make the pain worse, all right? Then you do the same thing on this, that way you can see it from the side. Push down, hold it about 5 seconds. You do it about 4 or 5 times a day, okay? And relax, all right? The third exercise I'll be showing to you guys is called a median nerve glide. This exercise is actually pretty important because it kind of glides, like the name says, your nerve along your wrist. It's very important because your nerve usually gets entrapped in this area, which is called the carpal tunnel. That's, as a matter of fact, why it's called carpal tunnel syndrome, because your median nerve, which is the nerve that runs through the middle of your hand and innervates the first and 2 fingers typically, and part of your third finger, usually gets entrapped in this area. And that's when you start having the numbness, the burning pain into those 3 fingers, okay? For this nerve glide, what you're gonna do here, you're gonna bring your fingertips in, you're gonna bring your thumb in top of your fingers right here, and then from here, then you're gonna extend. Once you extend your fingertips, then you grab right here, you grab your thumb and you stretch your thumb, okay? I'm gonna go over it again so that way you guys can get it. You close your fist, you bring your thumb on top of your fingers, you extend your wrist, and then you grab your thumb here and you pull it backwards, all right? So this is gonna be done anywhere from 10 to 15 times per day though. I usually recommend patients to do half of it in the morning, half of it at night. Keep in mind the carpal tunnel syndrome is worse at night, okay? So with that being said, I recommend you probably doing throughout the day before the night comes. So guys, okay? Right now I'm gonna show you just basic stuff that we tend to do in the office to help with this condition. Right now, what I'm gonna be doing here is some myofascial release. We tend to do this to decompress the nerve within this area. Like I mentioned before, you got the carpal tunnel right in this area. I usually tell my patients to just do this. And then I locate the carpal tunnel right in that ridge in the middle. So we open that, and this is exactly where the carpal tunnel is. So we got 9 tendons running under that carpal tunnel, as well as the median nerve, which is the nerve that really gets irritated in that area, right? So when we're here, I usually do one of the basic orthopedic tests we do is called nail tap. So we're here, once we detect the carpal tunnel, we kind of hit it here. Typically when I do that, patients tend to suffer from that burning pain going to the fingers, especially the first 3 digits, okay? So one basic thing that we tend to do in the office, we grab this first and 5th fingers right here, and then we grab the carpal tunnel right here, and we tend to separate the structures here. So we kind of relax, distract, relax, and distract the area. That way it tends to decompress that area. Patients usually get a lot of relief with this. We also integrate some grasping technique if needed, and definitely some chiropractic manipulation as well for the wrist. And that way our goal in this case is just to get that wrist moving and getting those symptoms slowly starting to get away, okay? So we tend to do this for about 8 to 15 minutes, anywhere in that time frame. And then what I tend to do after, just check the patient's symptoms, and if he's feeling better, we tend to then just continue with some exercises to do at home. So guys, this is just a heads up about carpal tunnel syndrome, the things you could do at home, things we tend to do in the office, okay? There's way more things that we do in the office, not only for this condition, we also treat other conditions. Typically, chiropractors are seen as back doctors. We do treat every other joint in the body, especially when it comes to common conditions such as carpal tunnel syndrome. So, guys, here at the Spinal Health Center, specifically Montville, Dr. Kim, Dr. P, Dr. Kelly, Dr. Dom, and myself, Dr. A, we're happy to see you. Any aches, we're here to help you. You have a great day, guys.